Would an expansion of Medicaid population take some of that pressure off? Perhaps. I think it would. It may also accelerate it. It may accelerate it because you will then have people saying, well, government's going to pick up the tab for me. Why should I participate in my employer's insurance program that I'm being offered? Because there's a copay there. You see, it's not a simple formula. It works out and manifests itself in a lot of different ways. And we have, even though we've had trouble with our Medicaid program financially to sustain it, there are a lot of states that are in a whole lot worse shape than we are because they do already at the outset have a greatly expanded eligibility population. Now we have an expanded population basis for our what's called the SCHIP program. It's Peach Care in Georgia. Children are eligible to a higher income level. I think it's 235% of the federal poverty level for our Peach Care program, as opposed to an adult who is at a much lower poverty level eligibility. Yes.
Well, have you considered the effect of with neighboring states such as Florida who have decided to expand, how that will affect your physician population and your medical providers who are considering choosing a state-based budget and not?
Well, you know, obviously, and I understand I had another Republican governor in New Jersey just came. There are all sorts of things. You know, every state has to make its own judgment call, and it's pretty much a financial consideration. I would not say that anybody ever made those decisions for political reasons. You know, I obviously would not make those decisions on that basis. I am making decisions. But in terms of physicians making a choice as to where to go, the reality is, you ask anybody who receives Medicaid reimbursement, what do they tell you? It is the lowest reimbursement rate out there, substantially below even Medicare reimbursement rates. We're having physicians already refusing to accept Medicaid patients because it's not financially feasible for them to do so. Many hospitals, of course, claim they're losing money if they take a Medicaid patient. So it's the old idea that volume doesn't help you. You know, if you're losing money on 10 patients, you've got to be making money by having 100 that you're losing money on, you know. So it doesn't really translate into the physician's opinion as to where they go. The only way that would translate into the physician's opinion would be whether or not the reimbursement rates were raised. That would be where they would make a judgment call.
Can I interrupt for just 1 second? Sure. I'd just like to poll people here. Who here has treated a Medicaid patient before in your training? And who here hopes that they will treat Medicaid patients when they become professionals?
Good for you.
Okay.
Good for you.
Stay in Georgia.
That's right.
Okay, one more question.
So assuming Obamacare will not be, or Medicaid will not be expanded in Georgia, are there plans in place to repair the current Medicaid system? As we know, there's many problems with it, budget-wise, and even the way that people can even access it, especially providing mental health care. I guess my question is, what's the plan to improve Medicaid services for those who are so low income and really need it?
Well, in terms of expanding services,
Or just repairing the services that exist and repairing the system and its cost?
well, we have to, first of all, we have to get waivers from the federal level at CMS to change our program in any fashion whatsoever. And I think last I saw, we have like 15 waivers that are being requested now, and they're sitting on them, and they won't give us permission to alter the benefits and expand or modify the program. So we don't have the autonomy at the state level to make those kind of programmatic changes. We have to get permission from the federal government to do that, and they're slow. There are some problems that I think Congress is going to have to address, quite frankly, because when the Affordable Care Act was passed, the mandate on states to expand was in the legislation. The Supreme Court has now taken that out of the equation. The statute does not contemplate that. And there are things that are going to have to be addressed, in my opinion. For example, some of you probably work in or have worked in hospitals that receive disproportionate share payments because they have a higher proportion of their patient base that is Medicaid eligible. Part of the funding formula to pay for Obamacare was to ratchet down and at some point eliminate those disproportionate share payments back to those hospitals. So I think Congress has got to address that, and I think they deferred the effective date on that for another year. I don't think it kicks in. It's going to kick in next year, but I think it's deferred to 15. But there are just a lot of things like that that I think Congress has to go back and readdress, or at least look at, and try to provide some answers to. One of the things that not only me, but a lot of governors have said is, if you will block grant the money that the federal government puts in or is proposing to put in to an expanded Medicaid program, if you will block grant that back to the states with some reasonable parameters as to what the states are expected to do, then we believe we can get an expanded benefit to the patients in our state, and that we can do it more efficiently. Because right now we are, sort of a one-size-fits-all pattern. We have very little flexibility. Unless we get a waiver, and those are hard to come by, as I said. I don't know that they will ever entertain that, but I think it is a viable option. Perhaps at some point in the future, Congress will consider that.
I think we're,
Let me take you, and I'll leave that last one. Yes, sir.
Sure. My name is Dr. Alonso. I'm a first year medical student at Mercer University School of Medicine in Savannah.
Good. I had on my Mercer tie yesterday. I'm sorry. Didn't know that.
Okay. And so I graduated from Harvard in May, and one of the reasons I chose Mercer was to talk with the path for me was the fact that it has a primary care focus, and it's particularly concerned with recruiting physicians to serve in Georgia to meet a demand that we all are aware of. And so what a group of us students at the Savannah campus have done recently, we've applied for an ALA student leadership grant off the Mega Alpha, the Medical Honor Society, and we were recently awarded it. That would provide about $9,000 in funding combined with our school, which has been willing to match that funding to establish a leadership curriculum program for the students. And so I was just wondering if you had any recommendations on how we as students could improve our leadership skills so that we're able to advocate more effectively for the needs of the underserved.
Well, first of all, I commend you for being interested in primary care. And Mercer, I think, with his focus on that, I think serves a great purpose, as does Morehouse, with their focus being that as well. I think doing what you're doing within the context of the educational institution and within the context of fellows who are pursuing degrees and going into the medical field, I think to be conscious of the fact that you have a role and you have a voice, I think that's the important thing. As you may know, one of the adjustments that was made, and that was made back a year or so ago now, was greater reimbursements for primary care physicians in the formulas, because it was a recognition that what was happening was that everybody wanted to be a specialist in something, because specialists get paid more in the formulas that we all have to operate under, both Medicare and Medicaid, and the recognition that we don't necessarily need all the specialists. We really need primary care physicians. So the reimbursement rates, I think, were appropriately adjusted to increase the reimbursement rates for primary care physicians. It's still going to be a challenge, and there's still going to be a great demand for primary physicians, because they are really the threshold, should be the threshold into the healthcare community. Let me just stop with one other thing that we are doing, and hopefully some of you will be a part of this. Last year we started, and we've again funded it in our budget proposal this year, is to create 400 residency slots in the state of Georgia. Because what we find is that a lot of our medical students are going through pre-K, K through 12, college, medical school, and then there are no residency slots in the state of Georgia, so they leave and go somewhere else and don't ever come home. So we think one of the ways of helping to reverse that is to have more medical residencies available in Georgia. So we're going to reach that 400 new residency slots in our state, and when you get to that stage of your careers, if you're pursuing MD, to do that, we have to have hospitals throughout the state be willing to be partners with it. And we're seeing great responses, I think, by many of our hospitals. And it costs them money, quite honestly, to participate in a residency program. And those that are willing to step up, I think they, first of all, I think we owe them a debt for being willing to participate. But I think they also recognize that there will be benefits to their community by perhaps keeping some of those physicians there once they complete a residency program. The other thing is, and you didn't mention medical college, well, Georgia Regis University, I don't want to be politically incorrect. We do have money in the budget, $5 million for a continuing ongoing assistance in establishing the cancer center there, and about $45 million for the cancer center building. Money is being put in there for that. Our goal is to have 2 nationally recognized cancer centers. Emory already has that, and we want, in the public arena, we would like to have a second one. We believe that Augusta would be the appropriate place for that to happen. We have money in there, and we hope it will be on an ongoing basis because that's a worthwhile goal. It'll help us all. Thank you all. Good luck in your
Thank you,
careers.
Governor.